Which of the following herbs can block thyroid-stimulating hormone, TSH, receptors and decrease peripheral conversion of thyroxine, T4, to triiodothyronine, T3? A. Lycopus virginicus, bugleweed, and Melissa officinalis, lemon balm. B. Z-maize, cornslick, and Sambucus nigra, elderberry. C. Berberis vulgaris, barberry, and Epimgraviolens, celery. D. Panax ginseng and Symphytum officinal, comfrey. The answer is A. Lycopus virginicus, bugleweed, and Melissa officinalis, lemon balm. Lycopus virginicus, bugleweed, and Melissa officinalis, lemon balm, have both been shown to inhibit conversion of T4 into T3 in the peripheral tissues, and have been used to treat mild cases of hyperthyroidism. The other herbs listed have no specific effect on peripheral thyroid hormone conversion. Berberis vulgaris is used to treat respiratory conditions, and infections such as the cold and flu. Epimgraviolens has been used to treat pain. Panax ginseng has been used as a stimulant, and to treat sexual dysfunction in men. Symphytum officinal has been used to treat gout, and disorders of the gastrointestinal tract. Z-maize may help treatment of skin diseases. Sambucus nigra is best used to treat upper respiratory infections. Urticularia, stinging nettle, leaf is used for all of the following except dash. A. Anti-inflammation. B. Psoriasis. C. Nutritional support. D. Allergic rhinitis. The answer is B. Psoriasis. Urticularia, stinging nettle, leaf extract contains antagonists of the histamine 1, H1, receptor, thus decreasing symptoms of allergic rhinitis and sinusitis. Nettle leaf extract also contains factors that inhibit mast cell tryptase, preventing degranulation and release of a host of pro-inflammatory mediators that cause the symptoms of hay fevers, and inhibits cyclooxygenase 1, COX-1, cyclooxygenase 2, COX-2, and hematopoietic prostaglandin D2 synthase. As a nutritive, nettle leaf is an excellent source of vitamin A, vitamin C, iron, and calcium. Nettle leaf has shown no benefit in treatment of psoriasis, though it may help to correct any underlying nutritional deficits. Which botanical is known for its antiviral, antiretroviral activity? A. Crataegus spp, hawthorn. B. Avena sativa, milky oat seeds. C. Melissa officinalis, lemon balm. D. Hypericum perforatum, St. John's wort. The answer is D. Hypericum perforatum, St. John's wort. Hypericum perforatum, St. John's wort, has shown significant antiviral activity against a wide variety of enveloped viruses and retroviruses. Melissa officinalis, lemon balm, and Avena sativa, milky oat seeds, are both better known for their sedative effects, and Crataegus spp, hawthorn, is used as an antiarrhythmic and mitigates oxidative stress in cardiomyopathies. What antimicrobial constituent makes Artistophilus uva ursi useful for treating urinary tract infections? A. Tannins. B. Hydroquinone glycosides. C. Flavonoids. D. None of these. This herb is not used for urinary tract infections. The answer is B. Hydroquinone glycosides. Uva ursi contains the hydroquinone glycosides arbutin and methylarbutin, both of which have shown significant antimicrobial effects in the urinary tract. The other constituents listed have no effect on urinary infections. Which of the following homeopathic remedy is indicated for irritable, colicky infants who cry frequently and arch their back and who are only soothed by bouncing or pressure, such as swaddling? A. Arsenicum album. B. Arnica. C. Chamomilla. D. Calcarea carbonica. The answer is C. Chamomilla. Children needing chamomilla are hot, irritable, and very sensitive to pain. Infants are prone to colic and gastroesophageal reflux disease, GERD. They will often arch backwards when crying, and will be soothed when bounced, carried, patted, or swaddled. These infants experience difficult dentition and will chew their fingers before teething. Arsenicum album and Calcarea carbonica are both more often indicated for chilly babies that are prone to anxiety, while Arnica is generally given for people who have experienced some sort of dissociative shock from a physical or emotional trauma. What are 3 good food sources of copper? A. Sesame seeds, cashews, green leafy vegetables. B. Grapefruit, pear, bean sprouts. C. Beef, eggs, apples. D. Tomatoes, bananas, rice. The answer is A. Sesame seeds, cashews, green leafy vegetables. Sesame seeds, cashews, and green leafy vegetables have among the highest levels of copper per serving. Other foods high in copper include crimini mushrooms, organ meats, shellfish, and beans. All of the other foods listed are low copper foods, often recommended for patients with disorders of copper metabolism, such as Wilson's disease. By what age should an infant be able to pull itself up to standing? A. 6 months. B. 12 months. C. 9 months. D. 18 months. The answer is C. 9 months. An infant should have the ability to pull itself up to standing by the age of 9 months. If standing is not seen after 12 months, the child should be evaluated for any type of physical developmental disabilities or delays. At what age can an infant begin eating solid foods? A. 4 months. B. 3 months. C. 9 months. D. 6 months. The answer is D. 6 months. Solid foods should not be introduced into an infant's diet before 6 months of age. Earlier introduction may trigger specific food allergies, as well as reducing breast milk production in a breastfeeding mother. An audible click when the examiner slips the femoral head forward is considered positive for what sign? A. Scarf sign. B. Babinski sign. C. Ortolani sign. D. Brudzinski sign. The answer is C. Ortolani sign. An audible click when the examiner slips the femoral head forward is considered a positive Ortolani sign. This finding suggests congenital hip dysplasia. Babinski sign is the presence of the Babinski reflex, which is normal in infants. Scarf sign is used to assess developmental age and muscle tone in neonates. Brudzinski sign is not related to the musculoskeletal system but is part of a physical examination in cases of suspected meningitis. At what age does the posterior fontanelle close? A. 4 weeks. B. 12 weeks. C. 16 weeks. D. 8 weeks. The answer is D. 8 weeks. The posterior fontanelle, which is the cartilaginous gap at the junction of the lambdoid suture and the sagittal suture, closes at 8 weeks of age. The answer is D. 8 weeks.